Hi, my name is Brittany Bieland, and I have case number 18, which is MM is in the baby aisle. She is looking at nearly every product on the shelf and shaking her head. I approach her and offer to help. She says that she is nursing and having problems with dried nipples. It makes nursing uncomfortable, but she does not want to do anything that will hurt the baby. She sees lots of products that contain lanolin, but she is allergic to wool. What am I going to recommend? So there are some additional information that I need to gather from her in order to give it a good recommendation. The first question I ask is if she's having severe pain or if there's bleeding. She assures me that no, she's not having severe pain and there is no bleeding around or on the nipple. If she were having more severe symptoms, as in pain or bleeding, I would refer her to her OB doctor, as this would be something I would not be comfortable with treating. Next, I ask her if she's having problems with flat or inverted nipples. She says that no, that she hasn't had any issues with that. Another additional question I ask, how long has this been occurring? She tells me that her baby is about 2 weeks old and that this has just been going on for about 2 days. She tells me she has no issues with the past couple of weeks since her baby was born, and this is just a recent issue. I also want to clarify what uncomfortable meant to her. She told me that while she is breastfeeding, it feels like her baby isn't sucking correctly and doesn't feel natural. Her baby was breastfeeding just fine for about the first week and a half, and now she's getting sore after feedings and has noticed that her nipples are a lot drier. I also asked her if this was her first time breastfeeding or if she has done it before. This happens to be her second child that she has breastfed. Didn't have any issues with her previous breastfeeding experience, and so she's new to this situation. She said she really doesn't know what to do since she's allergic to wool. I asked her if there's any product that she would like to try, and she said no, she has no idea what she wants to use and just knows that she's allergic to lanolin. And the final question I asked her is if she has a budget that she wants to stay under, and she told me that she would like to stay under $20. So at first I need to consider multiple factors when recommending a project for her dried nipples for breastfeeding. The most important things for me are to keep the baby safe and to keep breastfeeding comfortable for the mother to be able to enjoy this bonding time with her baby. So there are various products that will help with dryness, pain, soreness, and latching. And it is best to start with a variety of products and eliminate them based on what the patient needs. Additionally, we want to take care of this issue right now so that it doesn't progress to more severe pain and or bleeding. At my pharmacy here, BBRX and Supplies, we provide services like breastfeeding support for mothers, smoking cessation, and other various services. So the most common reason that a mother has an issue with sore, dry, or painful nipples from breastfeeding is due to incorrect latching. The baby does not only use the nipple to get milk, as most people would assume. They need to get more of the surrounding areola into their mouth as well. So when the baby latches, the nipple should be as far back into the mouth as it can, but not directly in the middle, more towards the roof of their mouth. Then their chin is the only part that should rest on the breast, where they're having as much of the areola as they can. So when they start sucking, they use their tongue and the surrounding area to propel the milk out of the breast. So in most situations where the mother is having problems, lanolin is the most common product used. It is used by placing a pea-sized amount on the fingers and apply to the entire nipple area after each feeding. And it can be applied before showering to protect from sensitivity. So this product is hypoallergenic, which means it is safe for the baby and the mother. So there's no reason to remove it prior to breastfeeding. However, in this situation, she is allergic to wool, and lanolin is a wax product that is secreted by the sebaceous gland of wool-bearing animals such as sheep. And since it's derived from animals that have wool, this would not be a useful product for her to use. At Walmart, this product is $8.84, but here at my pharmacy, it is $6.99. So another product we have available is Blistex Eternal Analgesic, which is 100% natural. It contains natural products like aloe extract, which is a good product for dryness, but it contains an external analgesic called methanol. And since this contains an analgesic, it would be helpful for pain, but in this situation, she is not having issues with pain. And since the baby will come into contact with the nipple, I would worry about the analgesic properties transferring to the baby. This would also likely numb the area that it's applied to, so the mother would not be able to feel how the baby is eating or latching. At Walmart, this product sells for $12.99, and I sell it here for $9.75. In this situation, I would not recommend this product based on the unknown effects that it would have to the baby. The next product we could consider is a natural nipple butter. This is a lanolin-free product that contains a variety of natural oils and butters. Some of these include cocoa butter, shea butter, and olive oil. This has been clinically tested, hospital recommended lanolin-free natural nipple butter. This product has been shown to be so safe for both mom and the baby, so it does not have to be removed before breastfeeding. The one negative aspect of this product is that it's not regulated by the FDA, but this would be an excellent product to use because it is lanolin free and it contains oils and butters that help with dry skin. Furthermore, this product can also be used as for other areas of the body that are dry, like elbows, lips, heels, even sore baby cheeks. I sell this product here for $10.99, and Walmart sells it for $12.97. Another product that is not medication based is a nipple shield. This is good for latch-on difficulties and flat inverted nipples. It is just a thin silicone product that covers the nipple. It can be used in between breastfeeding or while breastfeeding. My concern with using a nipple shield is that the baby could get used to having the shield on there during feeding. So when the mother would stop using it, the baby would not, could potentially not take the breast. I would probably consider this product if she were having more pain in between breastfeeding sensations, because then she would have a barrier between her breast and her bra. But this product would not be useful for her because she is having issues with dried nipples. At Walmart, this product sells for $9.14, and I sell it here for $7.49. Another product we have available are gel pads. These are mainly helped for between breastfeeding times. They are placed over the nipple right after breastfeeding and then removed right before the next breastfeeding. They provide a soothing relief of sore nipples. So right before breastfeeding, the gel pad needs to be removed, and then the nipple and surrounding area should be clean and dried off before latching. The pad can actually be reused for 24 hours and just rinsed off in between uses, and then should be disposed after 24 hours. This would be a beneficial product if she were experiencing tenderness, especially between feedings, but she is not experiencing much pain, so this would not be a product I would recommend right now. At Walmart, this product sells for $7.98, and I sell it for $4.50. So there is additionally a prescription product that a pharmacist can make from the prescription of a doctor that can help with dry, sore, cracked nipples. It is often called triple nipple cream. It is made with 1% hydrocortisone cream, mupirocin ointment, and nystatin. These three products help with multiple factors of sore nipples. So the hydrocortisone cream is a corticosteroid that helps with decreasing inflammation. The mupirocin is an antibiotic that can fight against bacteria, and nystatin is an antifungal that protects against fungal infections. At this time, this product really wouldn't be necessary for her. If her symptoms were to escalate to having more redness and pain, then I would say to consult her OB doctor, and then they may prescribe this product. So my recommendation for her would actually be using a combination of using the natural nipple butter and then ensuring the baby is latching correctly. So she can just apply this after breastfeeding and in between breastfeeds as needed for her dryness. But the first and most important recommendation would be that the baby is latching correctly. This will help with decreasing the amount of dryness she is having and also to make her feel more comfortable. In the meantime, I do want to give her a product to help her with the dryness she is having so it does not escalate to a more severe situation. And since she is allergic to lanolin, I'm recommending the natural nipple butter because it contains ingredients that help with dryness, such as olive oil and cocoa butter. This an additional benefit that you can use it for other dry areas of the skin, like chapped lips, dry elbows, in those chapped baby cheeks. I feel that this product is the most safe and beneficial option for her to use at this time. Additionally, I would have a discussion with her that if her dryness continues and starts becoming worse to the point where she is experiencing more severe pain and potentially bleeding, that she should consult her OB doctor. So decided to take my advice and purchase the natural nipple butter. She followed up with me in 1 week and told me that this product did work for her and that her baby is having better latching. Thank you.